All right, excellent. Well, that's we're at a pretty good number, so we'll make a start. Yeah, so thank you. Hello, everyone. Thank you for attending today's webinar, Utilising Data to Improve Workplace Safety. My name is Stephen Smith, Marketing Manager at Cardinus. I'll be your host today. First up, apologies for the mix-up in the webinar links. We had a bit of a difficulty with our webinar supplier, but hopefully you have a great experience today. But if you have any issues, you can direct message me in the chat feature below. But moving on to the webinar, today we're joined by two speakers with a lot to say, and only an hour to say it in. We've got Andy Hutt from safety technology company Safe365. He's been in software and tech industry for about as long as I've been alive, and now heads up the UK and Europe operations for Safe365. He'll be addressing technology and strategy in the convergence of behaviour, tech and data and safety management. We're also joined today by Peter Kinselley, our own head of health and safety at Cardinus, with experience in Linklaters and Mondelez and the like. He brings with him that high level of experience of communicating insight to the leadership team. And that's what he'll be addressing today. Andy will, of course, be kicking off, followed by Peter. Andy will then provide us with a demo of the Safe365 technology solution. You didn't think you'd get away that easy. Before we turn to a Q&A at the end. So throughout the talk, if you have any questions you want answered, any aspects that are too lightly considered or unmined, please drop us a question into the Q&A section for us to answer at the end. But yes, for now, I think that covers everything. So without further ado, I'll pass my good friend Andy Hutt to begin. Andy, please begin.
Great, thank you very much, Stephen, and good afternoon, everyone. So just to quickly briefly run through the session content today. So we're going to be looking at how we're using technology and data-backed findings to craft health and safety strategies and change some of those ingrained practices. We're going to look at how behaviour, safety technology and data are emerging, giving deeper insight and building confidence and enabling greater engagement in safety. And then we're going to be looking at understanding how to deliver insight to the C-suite. So many of the challenges that we all have in trying to get the C-suite on board and how we can influence those senior leaders and drive change. And then we're going to take a quick look at, as Stephen said, as the technology, just very, very briefly. So, I mean, Safe365, just to give you a quick overview, basically what we're doing is capturing unique pieces of data in terms of business, health and safety maturity. And we have lots of data in our data lake, some 2.5 million data points and continually growing. And we want to share some of these insights and learnings to help improve health and safety. And it's really our core purpose and what we're all about. So, very much a believer that technology needs to influence people in order to keep them well and safe. So this sort of reinforces our meaning or our purpose. And I'm probably not sure I need to tell you this, as we're all health and safety professionals and understand that the scale of the challenges we face, but just to flag the magnitude of the problem, taking some stats from the International Labour Organization in 2020, that there's been 2.78 million worker deaths, 374 million workplace accidents, which has a global economic impact of just under 4% GDP. So some real staggering figures there. And this is really why we, Safe365, are in business, and we're aspiring to really influence this global issue. So a little bit about our vision and why we're in existence is really to help make businesses more aware of their strengths and weaknesses in terms of their health and safety obligations. So once you know where you are, it's pretty obvious that you can then improve on all matters to health and safety and risk and track maturity. And of course, if you don't have that initial benchmark, and what to focus on. And this is really what we're fighting for and what we're providing, and it underpins really everything that we do. So how do we make an impact on people's lives? Well, we all know that safety is very much a contact sport, and technology needs to influence people in order to reduce injuries, I've mentioned before. So we influence behaviors, leadership and decision making through the product's ecosystem or functionality by providing clear and actionable information. So Safe365 in itself is not a traditional management system per se, like the Airs, Webs, the She softwares, the Spheres and the like. We don't go into that level of detail, but we operate at a much higher level and are more complementary to those systems that I've mentioned. And so we look more holistically at a business and equip them to become, very much aware, enabled, and effective. So we focus on the key elements to give an organization better information to make more informed decisions. So we're starting from the left there, we focus on the governance position. So how does the business stand up against its legal duties and its obligations? So looking at, how you're standing up against ISO 45001 and ISO risk standards and best practices, and providing key data insights on the whole business, not just those with not just as a business as a whole, but those with multiple internal organizations, but also your extended supply chain as well. So how do your contractors measure up against those standards? How do you know that they're operating health and safety to the standards as well that you require them to be as a supplier? And lastly, and by no means least, what are the obligations of the leaders in the business? And all these key focuses are there clearly to reduce injury. But whilst reducing injury is the core driver, there are many benefits resulting from injury reduction. Such as the social impact, for instance, so workers returning home safely and each day and being more productive in the community, creating a more positive culture. Which in turn, creating real benefits towards the brand of the business. So less staff churn, better employee retention, stronger commercial performance, better quality and efficiencies there, but better productivity in the workplace. So workers are spending more time at work creating value for the business. And of course, you will see, reduced insurance claims and improved legal compliance with, reduced risk of regulatory exposures and fines, losses, imprisonment and financial losses, etc. So there's some really underlying sort of key benefits, both very tangible and obviously lots of intangible ones as well. So many good reasons why technology can play a major role in helping to reduce incidents and accidents, but also saving the company money. So we all know that technology can be an enabler, and Safe365 really does, unlock deeper awareness within the business and help to build confidence and set that tone to help engage some of its staff. So it's really designed to influence leadership behaviors and decision making, as I've mentioned before. So this is an example of a very powerful interactive dashboard which enables even the lowest levels of health and safety or risk management to understand things like, what are the ingredients to generate the presence of safety, how the business measures up against the maturity model, so what are the strengths, the weaknesses, improvement areas. And it provides a top-down helicopter view of the business, so not individual risks, but rather complementary to those operational risk management needs, as I've said before. So in the center, once an assessment has been done, so effectively when you come into Safe365, you're asked to run a benchmark assessment, which takes about 90 minutes. And you're presented with 84 questions, which are broken down into 10 modules, as you can see there, really for sort of ease of consumption. But once you've completed the assessment, it provides you with a safety index score in the middle. In this particular case, we're seeing 49%. So 49%, what does that mean? Typically across our customer base of some 4,500 customers, if you're operating around about 60%, you're doing okay. You've got some strengths clearly, but you've also got some work-ons as well. So as I said before, this is really results of this completed assessment. Once you've done it, you don't have to do it again. And these 84 questions that I've mentioned to you about are sort of around the edge here. And these are if you will, 84 lead indicators, and the 10 modules in the center there are lead indicators in their own right. You know, and they're clearly really showing the weaknesses and strengths across the business, but at a slightly higher level. So we've RAG rated them. So obviously red is poor and green is good. So it's very, very visual in terms of where, you know, where the business is good at and where it needs to have some attention spent. You know, while customers that are running, you know, one particular assessment across the whole business, we have other customers that run them right the way across all their different operations as well. So, you know, this really starts to help senior leaders to make more informed decision by highlighting those areas for improvement right across the business. So in this particular case, you can see, you know, there's yellows and greens, and in some instances there'll be reds as well. So it really sort of gives you some common examples of, you know, where those work-ons are. So this intelligence really informs the health and safety strategy team in terms of the key priorities, which internal stakeholders need to be engaged to address the various work streams. You know, so it helps health and safety managers get the attention from the C-suite and the board around, you know, why resources are needed and what they will achieve. So you can see here on this particular example, there's some common threads across 8 different operations, that the management knowledge in all the disciplines around health and safety associated with management knowledge are weaker than some of the other areas. So it's quite a common thing across these operations. So it's something that, you know, it's a highlighted issue, and the board or the C-suite, you know, can make some decisions in terms of maybe we should put a training program together to get them up to speed, or whatever it might be. So taking this one step further as well, this can also be used with extended supply chain. So we have a number of customers that are really pushing this out to their contractors, their external contractors or suppliers. So, you know, they're thinking, well, you know, we want you to operate health and safety in this particular way to our standards. So, you know, we want you to run the assessments on your business. And, you know, you can report on all of your supply chain in this sort of way. And I'm going to show you an example a little bit later of how that in reality, how it works. We're collecting data, as I mentioned, and we use it to provide, you know, really useful and powerful feedback on how the rest of the markets are performing. So in this example, we're showing how various market sectors are performing. So you can see along the bottom all the various different market sectors there that we have as customers. And we're pretty much covered right the way across the economy. And the average safety index score within that particular sector on the top. So in this particular instance, you can see that the tourism industry is running a safety index score typically of around 73%. So that's quite an interesting one at the moment, because the tourism is not a business that is thriving right now during the current crisis. But what they seem to have done is you know, taking the time when they're maybe not so busy to get their house in order in terms of their health and safety obligations, and really sort of sharpening up their health and safety practices. What we've also overlaid here is incident and accident information. So the reds are the fatalities, and the light yellows being any safety concerns. And you can see typically construction there is a key one. No surprises that construction is a high risk business and therefore going to have the higher rates of incidents and accidents. But again, it's really helping organizations to understand exactly what their peers are doing in those various market sectors. And although the construction one there sort of is a bit of an anomaly, throws out some obviously a larger spike, typically what we're seeing now, and we have evidential proof of this, that the higher the safety index score in a business, the lower the incident and accident rate. And it sort of makes sense, really. But it's not just about you know, making, you know, whilst we all thrive to make workplaces a much safer place, it's often very, very difficult for health and safety professionals to get the ear of boards and C-suites to, you know, to ask for investment in particular areas to help improve. But this is just one particular case study that I wanted to articulate here, where, you know, we can actually measure ROI in these sorts of technology products. So this particular case study is a major local council of some 9,000 employees, and it was a 2-year study. And the client improved their safety maturity by 10%. So that safety index score was improved by 10% over the 2 years. The average that we see in our customer base is about 6%. So they were 6% per year. So they were just below the average of what we see. But they calculated that for every 1% improvement in their safety index score, they could save £5 per employee. So it might not sound a great deal, but if you extrapolate that out to obviously all the employees, then, you know, the savings can be significant. So I'm not going to go into too much detail on the costs today, but you can get some information on our website. But the organization implemented multiple licenses across their operations because over the 2 years, I think they spent something like about £100,000, but the direct cost saving of that was £450,000. So they saw they also saw a corresponding decline in worker claims of 40%. So of course, in addition to the direct savings, there's also productivity factors as well. So you know, with the value of keeping those workers retained and productive, of course, I think there was a factor of 2.5 there. So, you know, there are some really powerful, tangible savings here, and I'll put a little box down on the right-hand side there, so you can just sort of maybe see where potentially your organization might fit. But of course, you know, there are lots of other more intangible benefits here as well. And we all know that trying to convince boards to invest money in health and safety has its challenges, but this type of return on investment should get their attention. So just continue with the case study for a moment from the previous slide. They believed that being able to initially understand where they were and then to fully understand those areas of improvements where they need to be made completely turned around their organization from a health and safety perspective. You know, in particular, it was the use of the leading indicators which provided the focus, but also, and very important, it was easy for those who are not health and safety professionals to understand. So, you know, your C-suite, your operational heads, etc. And it really engaged them and helped them to create a positive culture. So they're able to create sort of running improvement projects, empowering the leaders of some very diverse operations. So they, of course, being a local council, had local parks, they had waste disposal, they had libraries, they had offices, all sorts of various different operations. But the key point is that the technology really helped the operational leaders get involved. And it created a competitive culture between the operations as well. So who could improve the most over a specific time frame? But they absolutely could not have achieved this without knowing where they were to start with. So the power of the information and data that they got really helped to engage the senior operational leaders in the C-suite to drive this change and create this very, very positive health and safety culture which they now have. So now I'm going to hand over to Peter, where he's going to talk more about how one can help leaders to drive that change. Peter, over to you.
Yeah, Andy, thank you. Just as a quick reminder, if you've got any questions, we've got the chat box at the bottom. So if you'd just like to drop them in, and I shall just start my, actually, hang on. Sorry, I seem to have a little bit of a problem with my screen share at the moment. Here we go. share, that's better. Okay, so good afternoon. As Stephen said, my name is Peter Kinselley. I head up the consultancy team at Cardinus Risk Management, and I'm just going to take you through a very short presentation to give you a little bit of insight in how I would encourage you to engage with your leadership team and actually be able to utilise some of the tools that have been shown to you today. So I'm going to talk to you a little bit about what a maturity model looks like, and also compare it with the plan, do, check, act model that ISO 45001 provides. So I'm going to start off with a little bit of a challenge to you. So, you know, when we look at the training and identify the information that's provided to us by the health and safety executive, we are told that we can build a safety case for a business based on 3 questions, okay, and they are to look at the moral, legal and financial implications of, you know, sort of managing health and safety in a business. But I don't actually see that the business case is actually that easy as, you know, sort of these 3. And I think also the training that we are actually provided doesn't prepare us for our role as leaders within a business. And one of the things that I would reinforce to you guys is that in any role where you're a health and safety manager, or you are involved in managing health and safety in an organisation, you really have to, you know, consider this as a leadership role. So when we look at it, you know, sort of, if, you know, this isn't actually enough for us to be able to build a business case. So when we look at this question of how do we develop a health and safety management system and engage our leadership team, we really have to look at the data that's available to us and actually look at what's going on around about us. And what I really consider is that when we are looking at developing a health and safety management system or improving a program, you know, we've got to really challenge our own question set. So our traditional approach, if we you know, follow the moral, legal and financial basis, would be is, you know, we gather together some information, we make a plan, okay, and then we get some buy-in and we execute on it. We all know that it's not as simple as that, because actually, you know, from my experience and probably from yours as well, is that we get pulled in all sorts of different directions. So actually being able to establish a management system, we really have to be quite flexible in the approach that we're taking. The other thing as well is that with the information that we gather in, how do we validate it? How do we make sure that it's, you know, it's correct? And also, you know, from within the business, are we getting it from the right places as well? There is another question based around the competence of those people that are actually providing us with the information. So actually, are they able to give us the best that's available to us? So in reality, when we're looking at building a management system, we shouldn't only just look at, you know, whether we're actually building the right case, but what we want to do is actually make sure that we're looking at things like competence, and then it goes on to the next stage, which is also engagements. And this very much fits in with the 2 models that we have available to us. So when we look at developing the plan, what we should be doing is looking at a few key areas. So first off, for me, the most important thing is to get to know your audience. And I think this is one of the key things. As health and safety practitioners, generally we sit in middle management. So the challenge that we actually have is that the C-suite can seem quite a long way away. But actually this is the moment where I would ask you to be quite brave. And that is, if you want to know what they want, it's actually, you know, you've really got to get to know them. So ask for an appointment with your senior leadership team and try and get to know them. It's also important that what you're doing at the same time is identifying your key stakeholders and those people that will influence within the business. And there are key people that you will identify that actually have a big say in what goes on in the business. And it's really important that what you do is you get to know them and actually ask for some help and support. And that can be done in a number of different ways. You know, one way is to actually go and find out what they do, what makes them tick. You know, so rather than saying, I need help, you know, why not frame the question as, you know, actually, I would like to get to know you. I think the other thing as well is that if you're going to develop a program that's based on the maturity of it, you really do need to get to understand the business values, their objectives, and actually also where you sit in the supply chain. And for me, this is really a very important part. So, you know, when you look at how you're going to develop your management system, you've got to actually make a choice based on what value you're also providing to the organization in what you develop. So, you know, from my perspective, when I've been looking at an organization, when I'm looking at an ISO standard or a maturity model or some other form of management system, I base my recommendations to the organization on where they sit in the supply chain. So in other words, if you are providing goods and services to other people, a program like ISO 45001 could be really beneficial, but there are others like safety in procurement schemes as well. So, you know, when you look at this, make sure that you actually choose the right approach. When you look at performance, you also need to have a look at, from an organizational perspective, what have they been doing historically? Because if you're going to take them on a journey, you want to be able to actually understand where you want to take them from to where they go to. And then the last thing is, when you look at your competitors, there is often a question around, can we get benchmarking? Now, Andy's actually shown you a form of benchmarking that Safe365 do. But when you look at external organizations, so if you've got a competitor, some of the best ways to be able to understand what they're doing is to look at their annual reports and find out actually what is it that makes them tick from a health and safety perspective. They might not be doing any reporting, but at least that will give you some evidence on actually where they see the value of their occupational health and safety management system. And it could give you some leverage with your leadership team to actually have a look at, you know, the reason of why we're going to do this. So just moving on. So I've spoken to you about a maturity model and the plan, do, check, act model, which is one that's supported by ISO 45001. I particularly like the maturity model, and the reason why I particularly like it is that actually focusing on leadership and ownership of health and safety. And one of the key objectives with it is to take you on a journey from where health and safety is actually seen as a reactive measure of performance to one where it is owned by everybody. So generally within an organization with a health and safety manager, ownership will sit with them. And actually, you know, there will be some engagement at some level, maybe through a health and safety committee or through a management report. But in reality, your level of engagement is actually pretty low. And this comes back to a point Andy raised. If you're looking at trying to eradicate accidents and also, you know, sort of make sure that you've got a, you know, a good health and safety organization and your culture is right to support your ambition of reducing accidents down to zero, then you really have to involve everybody and actually take everybody on a journey of actually understanding of what's required of them. So you need to be able to have a tool that will be able to give you a measurement, some quick wins, and also identify where your strengths and weaknesses are. And one of the great things about the maturity model is that this is based on actually being able to show how the organization is engaged in health and safety. So I'm a particular fan of these types of these particular programs. And also what it allows you to do is actually base your management system on the business and its values, and also create an engagement model. Reporting on one page on health and safety is one of those things which most organizations aspire to, and using a maturity model actually will allow you to achieve that. If we go over to the other model, and what I've done is I've actually used the model that the HSE show for HSG 65, but again, it's very similar to that used by ISO 45001. Now, it's great at providing you a framework and also helping you actually understand how to establish and manage your management system. It also gives you a framework to provide continual improvements. But actually, this model is actually slightly more difficult to implement, in my experience, because actually trying to encourage people to be actively involved in it in every stage of the way is much more difficult. So my challenge to you is, in reality, if you want the best, you really have to use both of these systems to be able to design a framework around what you're doing, and also allow yourself to actually create something where you're actually asking people to engage. Now, coming back to sort of my experience of these types of models, here at Cardinus Risk Management, we actually have got ISO 9000, 14001, we've got 27001 and 45001. And the reason behind that is we recognize where we sit within the supply chain. So for us, that gives us the ability to provide our clients with evidence that we take health and safety very seriously, as well as also delivering a service to them. So for us, it's really very important. So just to finish off, and I do recognise that, you know, this is a very short presentation, but if you are looking at developing your business plan, you should really see this as a project. You really do need to engage your teams and also get to know your business and your leadership team, and also to actually develop the best program for yourselves. You really do need to have a look at what is it you want to achieve, and I think you've got to explore, you know, what both these types of models will give to you. Okay, I'm going to hand back to Andy now, so I'll look forward to speaking to you during the Q&A session.
Great, thank you very much, Peter. So hopefully you are, what you're seeing now on your screen is the interactive dashboard for Safe365. So when you come into the dashboard initially, or into the product, it's a very, very simple case of setting up the profile of your business, which takes about a minute, something like that. And then you'll be presented with the assessment. And as I mentioned before, the assessment is basically 84 questions, which are collected into 10 different modules for ease of consumption, and it'll take you about 90 minutes to go through the questionnaire, but you only have to do it once. And each one of the questions that you will answer will have 6 levels of maturity, if you will. So, you know, you might be asking, you might be in a particular discipline, and I'm going to show you one of these anyway. So it'll ask you, do you do it, or on how well do you do it? And we're going to take a look at that in a minute. So I'm not going to show you the actual assessment today, because that'll take too long, but we're going to show you some of the results. So what you're seeing here is the result of an assessment. It's given us a safety index of 47%. You can see that it's quite, we've got some good work-ons here. So red being poor, amber being okay, and green being good. So obviously cultures and behaviours in this particular example we're doing very well at. But actually director knowledge and also verification and audit activities, we've got some work to do there. Okay, so it's very, very graphical. It's very easy, very quick to understand where some of the strengths and weaknesses are. So in the middle session here, sorry, the middle part of the circle here, you can see the various modules, and on the outside you've got all the various different disciplines within those modules. So some, in this particular case, we've got 8 or so, but others down here, the health and safety management system, we've got about sort of 14 or 15. Very typically what we see in some of the initial results is that the health and safety system here normally is pretty strong. So it's normally quite green, actually. I mean, everybody's got a health and safety management system of some description. It's the law. But actually what we do see as well, contrary to what this is showing, we actually see the cultures and behaviours piece normally quite weak, because the organisations haven't really got to grips with necessarily ironing out all their weaknesses, and so forth. Therefore, the cultures and behaviours piece tends to be a bit of a work on. This one is quite true. Out of all our customers, it is the worst one. So what is the director's knowledge in terms of health and safety within the organisation? It is the one that offers the most improvements out there, and we're going to jump into this one and show you that sort of an example of what we're covering here. So it's a very interactive dashboard, so I can click on the module here of director knowledge and we can just dive straight in. So the first thing it shows us is a little bit about, well, what do we mean by director knowledge? So all directors must develop and maintain knowledge of the health and safety matters in their organisation that they're director of on an ongoing basis. This is not us saying this. This is what the legislation is saying. This can be sometimes a bit of a an eyebrow-raising moment sometimes, where lots of companies didn't recognise that this is actually part of what one should be doing. If we scroll down very quickly, it gives us those, in this particular case, 8 sort of disciplines, if you will, as to what we should be doing. And what we're doing is providing you with some actions, which we're going to go through in a minute. You can scroll down a bit more, and we've got an audio-visual file here which you can play, and it's just really highlighting why this is important. If you don't want to listen to this, you've got some narrative there that you can read. We've got a risk system, if you will, built into the product, which is highlighting some key priority areas for us. So what it's saying is these are priority areas, and if you focus on these, it'll help you to raise your safety index score. So what we'll do, let's drive down into some of these key areas and see what it's offering us. So we'll just pop into Induction here. So I've clicked on that. So what it's initially showing us is that when we went through the assessment, and I'm going to show you the question in a minute, we would have scored ourselves in this particular case as well. We don't do inductions. So let's just have a quick look at the question. So this is the question that you would have been presented with in the assessment. So do all directors receive a director level induction on the company health and safety system? And we've got 6 levels of maturity here. So we've selected no induction, but obviously you've got, all reviewed manually. So we're absolute rock stars at doing this, and we do it incredibly well. And you would score yourself during the assessment somewhere in here. Scored ourselves with no induction, we don't do them. It's highlighted as quite poorly. But because of that rating that we've given ourselves, the system will then provide you with some actions to improve your rating. So the top one here is develop and implement a director induction process. So we can open up that, and what we're providing here, or what you're going to see here now, is one of the sort of 300 different resources that we have in the product to help you better and improve some of these poorer areas or weaknesses. So in this particular case, we have a director induction template which you can use. So I'll just click on that. You don't have to use these templates. If you have your own, you're very welcome to use your own, but these are just some examples of some of the templates that we've got to help you sort of get a kickstart. And I'm just going to drag that onto my screen so you can see. So it's as I said, it's a template where each director would put their name in here, their role. The inductor could be the health and safety manager, could be an outside advisory company you're working with. Basically, it highlights the induction topics, the induction actions, and as the director works through the induction, he or she would sign it off, as would the inductor. And then once these have been signed off, they can be then stored in the system as a verification document. So going back to the system, we have a files section here, which I've created some folders. So it works in the same way as sort of SharePoint. So you create your own folders, and then you would store all your documents relating to director's knowledge in that particular folder. So you know, if you've got an audit or something, that somebody walking in and saying, prove to me that your directors are inducted in health and safety, you've got some sort of documentation there. Okay, so, you know, let's just make an assumption that we've gone through some of these and we're now doing it a lot better. So now we might want to think about rescoring ourselves. So for argument's sake, our directors are fully inducted now and it's all reviewed annually. We're absolute rock stars at this now and we're doing it incredibly well. So we're now going to rescore ourselves. What you'll notice immediately is that the safety index score goes to 48%. So we'll just have a quick look at that on the dashboard. And there we have our spike here of 48%. Now it's still showing red because the risk algorithm that's working behind the system is saying you've still got some work to do. But if we were just to take another one very, very quickly, so this is all about, do the boards have health and safety on their board meetings at all, or their monthly board meetings? So in this particular case, they've scored ourselves that we don't do the agenda. It's the same thing. There's the question that would have been presented to us during the assessment, of which we've scored not on the agenda. And here's our actions to improve our rating. The same thing again, we can go into the actions. We've got a director meeting agenda template there if you wanted to use that or use our own. And once you started to make improvements in that area, we can start thinking about rescoring ourselves. So as you can see, it's one of these, it becomes an improvements platform, for want of a better word. So if we just rescore ourselves here, saying that we do this really, really well now, and you'll notice the safety index score goes up to 49% now. Let's have a quick look at the dashboard. And here we go. We're now starting to see some real change. And because of this visual change, we're getting a lot of feedback from C-suites and senior leaders in the business that they really do engage with this because it's very, very easy, very visual to understand. So clearly and I mentioned before, you know, this is not something that you can jump from 49% to 80% in a period of a month. You know, there's a lot of work that's involved with this, but the important thing is that you can really track the maturity. It's highlighting where your weaknesses are, so you can really focus on those key areas. And the average sort of safety index score increase from our customer base, as I mentioned, is about 6% a year. So, you know, you've got to look at this as a lengthy, you know, sort of projects, as it were. But what you can do, of course, is, you know, you can set off multiple projects with various members of your health and safety team or your operational leadership teams or whatever, and get obviously a lot of these work streams going on in parallel. So some of the reporting, just very quickly, I'm conscious of time, so I don't want to delve too much into the product at this time. You can create these assessment reports. So the way that our customers tend to use these is that they create them monthly or quarterly for senior leadership or board meetings. And they're very, very simple to create. You just click on the assessment report box there. And I've got the donut of death. Here we go. You're provided with some boxes that you can just fill in with some summary information, some of your key statistics in the business. And then once that's been created, I'll just download an example for you. They're very, very easy to create. So this is a very typical assessment summary. It's obviously 8th of December today. So it looks something like this. Now, the boards and senior leadership teams really love this sorts of reporting because A, it's very, very simple and it's very visual, as you'll see in a moment, and very simple to understand. Okay, so we can go through down into some of the initiatives completed, the worker engagement projects, and then we go on to, well, where's our health and safety capability at the moment? So it shows our safety index score. It produces a sort of a web diagram, a radar diagram, if you like, of where the strengths and weaknesses are. So in this particular case, we know we're doing okay with cultures and behaviors, but our director knowledge is still weak. And then it focuses on health and safety objective. So when you come into the product initially, I mentioned the profile setup, it asks you to select what your objective is. And it gives you three options. It gives you, we just want to be compliant, we want to push ourselves beyond compliant, and or we want to become an industry leader. Most organizations start off with compliance, and then as they get more into it, they do push themselves a little bit harder. So we'll give a quick overview of where we are with each module against our organizational goal. So again, very, very visual, very easy to understand. And then we'll just drop in ability. So using that RAG rating that you saw on the dashboard, again, we use it here. So we know that director knowledge is weak. And here are the three key actions that we really want to be focusing on. So this is the board really getting some insight of some powerful information to help them make some decisions of maybe where they need to invest some time or money. And of course, every time this is run on a monthly basis, providing there's been some changes, this data will change. Okay. So we also, I mentioned before that we have a number of customers that actually provide or run multiple licenses across their business. And I'm just going to show you some example reports that are used to give them insight into what's going on across their whole sort of ecosystem. So this is what we call a multi-site report. So this is an example of a subcontractor business, or a company that uses subcontractors in their extended supply chain. So there's some narrative, some text. We've got a bit of a table here which is showing us all our contractors, where they are in terms of their health and safety index. So again, using this color coding, so it's very, very visual. So you can immediately hone in on those organizations that really aren't performing. But more importantly, as we scroll down, it gives you their own Starburst dashboards as well. So clearly we can see that thrust rush drilling here is doing extremely well, and it really highlights some of the good areas that they're doing and still some areas of improvement. But as we scroll down, very, very visually, it sees the ones that are not performing. So Mr. Build It here Limited hasn't even started their assessment. So again, this helps health and safety leaders to really focus on where their time and effort needs to be across their supply chain. And you can have as bigger or as small supply chain as you wish. And indeed, you can utilize this type of reporting across your own business, across your multiple operations as well. So it doesn't have to be just the supply chain. The real thing here is visualizing, seeing your whole ecosystem from a health and safety perspective, so you can really get to making some of these decisions a bit quicker and where you should be spending your time. Okay, just the final piece, and then we're going to wrap up some questions. We have a performance tab here. I'm not going to go into the mobile app today, but we do have a mobile app that allows you to capture incidents, accidents, run risks and audits. Also, you're able to create checklists, so you can, whatever checklist you might think you want, you can create that. You can do hazard spotting. You can run user or company surveys as well, health and safety surveys right the way across the business, so you can start pinpointing some of the major issues that you've got in the business. So that's a very, very intuitive app that works on all the sort of standard Android and Apple platforms. But as I say, I'm not going into that today because we haven't got the time, but I'm extremely happy to do that on a one-to-one basis, or indeed, if there's a lot of interest, then I'm happy to run another session like today and to cover that. Okay, so hopefully that's given you a sort of 50,000-foot view of Safe365 and the type of reporting that it can provide and the ease of use. I'm now going to hand back to Stephen, who's going to start the Q&A session and wrap the session up.
Fantastic. Yeah, well, we had a question just come in now. Any plans for an environmental version?
Yes, very much so. So we've been pushed on there's environmental one, there's a security one that people have been asking for as well. We've actually just launched a safe contractor one called Qualify 365, which is all about how to manage the supply chain and contractors a bit better as well. So that's just being launched as we speak. But environmental, yes, it will come. I can't give you any timings on that now, but yes, it's on the agenda.
Fantastic. I've got one for Peter that we had in prior to the webinar. Why do you consider maturity assessments to be an effective model to follow?
Stephen, thanks. We also had a question around the maturity assessment in the program as well. So what I'll do, I'll just combine the two up. So the reason why I think they are more effective is that, or particularly effective, is that it provides the opportunity to create engagement with people and look towards ownership. So what you're actually doing by taking on a maturity type model is you're setting out an agenda of engagement. And I think from a health and safety perspective, that for me, there are two areas that really are, you know, sort of so important if we are going to drive down accidents. So one is actually good communications on what's expected of people, but the second one is very much based around driving ownership away from the health and safety team to those people within the organisation, so that they actually own safety in everything that they do, so in their roles. So when you're looking at your programs, effectively, you know, if you have that ambition of improving health and well-being, then you've got to really have a look at, so who owns what, and that actually becomes quite a complex, consideration in an organisation, because safety can sit in a number of departments, so HR, operations, facilities, security, and each of those have their own priorities. But when you look at people's health and well-being, because it's so important, particularly at this particular time, actually moving ownership to the individual to actually accept their responsibilities, and also driving a servant leadership approach within an organisation will mean that you can actually encourage an organisation to be a safer and better place to operate in within the current cultures that are already established. So, you know, what you're actually doing is developing a program that will sit well within what you're doing. And I think also the other beauty of a maturity system, and again, this comes back to what we've, you know, sort of been shown here today by Andy, is that you can end up with reporting on a page which allows you to actually focus on not only those good areas where you're being successful, but actually identifying those areas where you're weaker, and actually allowing people to see in real terms what they need to do to improve their programs.
Fantastic. I think we've got probably a couple of questions we can fit in. So we have a question in the Q&A, Andy, from Bruno Sano. How flexible is Safe365 in regards to what extent the platform and questions reflect the specifics of an organisation?
If I understand the question correctly, at the moment the questions set is absolutely set and can't be changed, and that's purely because it's in accordance with the legislation. And if we change that, then you know, we're not really going to be effective on the sort of the governance side of things. So it is something that we're thinking about, to allow an organisation to develop their own question set, but not something that's on the radar, you know, early on at the moment, if I understand the question correctly.
Okay, and is that reflected regionally as well? Do the questions change?
Well, yes, they do. I mean, obviously, you know, the company was born out of New Zealand, so you know, we're very much in you know, in line with WorkSafe over there, which is pretty much the same as HSE here. But absolutely, so it does change per region. So if we were to, you know, provide a system for the US, for instance, then it would comply to OSHA regulations.
Yeah, fantastic. Okay, and then lastly, Peter, just quickly then, I think we've got a couple of minutes left. So how can I benchmark my organisation against others? Kind of question.
This is a real quandary for most, and I sort of very much touched on this as part of the presentation. Generally, benchmarking is a very difficult thing for an organisation to achieve. So, you know, when you actually have a look at, you know, how we're performing against other organisations, there are different forms of audit processes out there that will actually give you an indication of how you're doing against other organisations. But my advice to you guys, you know, on benchmarking is that I would really look inwards rather than outwards on performance, because you're not benchmarking apples with apples. You know, what you're actually doing is you're benchmarking your organisation, which fundamentally could be quite different and potentially is more complex than other organisations. So what I would do is I would focus on actually what are your priorities as a business. So this piece of work that I was talking to you about going out and meeting with your leadership teams and actually getting to know them, I can't understate the value of that to you. You know, you really need to do that research and actually get to understand it. And I'll give you a couple of examples of, you know, sort of, you know, how I changed my view on things. In that, when I was working at Mondelez International, I was asked to go and work with the sales team that were based in Paris, which you would sound, you know, would sound like a great thing. But the team themselves actually worked in the supermarkets around the Paris area and started work about 5 a.m., which meant quite an early start for me. And also what ended up being is a really long day. But what I found from that were, you know, there were a number of issues based around, we did a load of promotions. And again, those that are familiar with the French supermarkets, what you will see is when you go in, there are big cardboard sections where you know, have promotions where you can buy good value items. And the company used to have them. And I spent, you know, 3 or 4 hours putting together some of them. And by the end of it, I actually found I had lots of small nicks and cuts to my hands because of actually the way they were designed. And I could actually influence designing out the issues that those guys had had. And they'd really, the sales team had basically put up with it because as far as they were concerned, you know, they couldn't see a solution. So, you know, I managed to actually make a, you know, a big change there. And then the other thing that I saw was that I was with one of the area managers who drove from Lille in France into Paris, which was probably a, you know, sort of an 1.5 hour, 2 hour journey, spent a day with his teams going around the various sites and then driving back. And, you know, the guys were putting in a big shift, plus also doing the driving. And one of the other things that we discussed as a result of me going and visit was actually making the areas for the area managers smaller so that they had less driving to do and therefore, you know, were less tired in what they did. And actually, you know, by getting to know the organisation meant that I also had people contacting me with, you know, questions which they'd never done before. So there was, you know, definitely a positive outcome. So, you know, I would really encourage that people do that.
Fantastic. Okay, well, that's all we've got time for. Thank you very much, Andy. Thank you very much, Peter. We'll be sending out the recording afterwards, and just to those who haven't been able to attend, and to the rest of you. And we'll also be accepting any questions. If you've got any, do email in. But for now, thank you very much. Have a great afternoon, and see you later.
Okay, all right. Thank you.
Bye.